uh, this session before, you were not here before we broke for the tea. I had promised the audience a scintillating CEO forum, and you have made it to happen like a boss of the meeting rather than chair of the meeting. So fantastic, and big hand for Dr. Ella. And thanks to all the panelists. It was in fact very in-depth and deep understanding of subject, and also the answers, including the innovations that we are talking about or the impact on the environment that we are talking about, which is fantastic. So this is now my pleasure to wrap up the meeting, and I would like to start with some of the keynote messages out of the last 3 days intensive, extensive, and high quality discussions, deliberations, and interactions spread over 12 high-powered sessions between the most learned chairs and panelists on the theme of DCVMN's 23rd Annual General Meeting, which was Global Equity and Timely Access, COVID-19 and Beyond. So I recall very fondly what Dr. Tedros had said in his video address, that the global rollout of more than 12 COVID-19 vaccine doses is the largest and fastest in history, with an estimated 60% doses produced by developing country vaccine manufacturers. Despite this achievement, stocking inequities in access to COVID-19 vaccines remain. And I remember what my sister Yodi said, that equity is not equality. So I think we need to really reflect on the messages that are coming out of this intensive deliberations. And in terms of, I will not go through very long discussion, but I think there are few important topics just to recap, so that all of us are fully aware of what we have discussed and what we are looking at. So in terms of pandemic preparedness response, the idea is to develop a holistic approach towards a pandemic preparedness response, including but not limited to predictive models, expeditious identification, characterization of strains, shrinking R&D timelines, and manufacturing, including tech transfers and related challenges, scaling up and scaling out, regulatory harmonization, and early risk funding. In fact, there was a lot of focus on revitalizing the routine immunization because developing country vaccine manufacturers are contributing more than 70% of the world's total EPI vaccine demand. Sustainability is one of the key words that has been appearing repeatedly in the discussions, and there were 5 C's, that the collaborative surveillance, community protection, access to countermeasures, clinical care, and the central element being the emergency coordination. In terms of global equity and timely access, again, there were 4 parameters which were importantly identified: financing and risk sharing, political will and export controls, regional manufacturing and flexible supply chains, partnerships, and synergies. So in terms of partnerships, I would say it is public-private partnerships which has been very well exemplified by the visionary statement: if you want to go fast, you go alone, but if you want to go far, you go together. So, of course, Gates Foundation has been historically creating partnerships. However, there is now a paradigm shift from global north to global south, building muscle over a period of time to create the ecosystem for health. So, another point which came up very crystal clear was that the focus has to now move from health security to economic security, because the IMF has estimated the impact of COVID-19 itself was $13.8 trillion. It goes beyond doubt that the focus is Africa, And the kick the tires, I think, was wrongly labeled by me. So now it is kick the wall. So we will take that. And key issues are to bridge the gaps in terms of equity, the importance of human capital, finance, regulatory, and supply chain. And the lesson learned was very encouraging to find that the vaccine manufacturing existed in Africa way back in 1937, and they got the first pre-qualification in 1967. And of course, to leverage Senegal experience through the, though the concern is that as of date, only 1% of the total vaccine needs of Africa are being fulfilled by the local manufacturing. At the same time, the encouraging point is PAVM has drawn a framework for action to ensure public health security with a goal to reach 60% of Africa region's requirement by 2063. But one major challenge raised from industry side was supporting local procurement mechanism to ensure sustainable manufacturing capacities in Africa for Africa. So leveraging collaborations by various organizations is the key. Strengthening laboratory monitoring network to conduct clinical testing is a priority, and also to conduct the clinical trials in Africa. So I think very clearly it came out that the capacity, capability, and changing the model are some of the steps forward. There was no doubt that the DCVMN partnership is critical in all these parameters. So on capacity building, as His Excellency Antonio Guterres highlighted during this year's UNGA high-level event on ending the COVID-19 pandemic in New York last month, we must close the pandemic preparedness gap. Now is the time to strengthen our defense against future threats, investing in local manufacturing and well-supplied health workforce. We must never be caught so unprepared again. Let's end this pandemic once and for all. So how we can achieve equitable access and timely access to vaccine remains an important priority, and we truly are at an inflection point in the pandemic to be better prepared for the next one. Therefore, the theme of this capacity building panel was very timely in light of ongoing discussions and was titled Connect to Protect. So UNICEF's support to manufacturers in building capacity related to market intelligence and processes is highly and deeply appreciated by DCVMN. In summary, looking into the future, regional vaccine capacity building continues to be an important discussion topic as a potential solution for closing the gap in terms of equity of where vaccines are made and where vaccines are used. Ongoing resilience is needed to help developing countries achieve an optimal vaccine portfolio based on a mix of programmatic and financially sustainable product decisions. Again, a very important point came up that the methodology to support strategic intent through technical, fact-based information and tools is important. So the innovation in technology, and you heard various manufacturers on that, the innovation means different to different people. The idea is to offer affordable solution to the customers. Thanks to the manufacturers for sharing novel and innovative technologies which offer end-to-end economic solutions for improved efficiency and higher productivity. I think almost in every discussion, the regulatory reliance and flexibility was highlighted, but particularly in the session on regulatory, this was encouraging to note that the ROI of USD 30 to 40 savings per $1 of investment of PQ cost is a great positive indicator. Another important milestone was that approximately 5,000 regulatory approvals in 175 countries as on 15th August during pandemic goes to establish the efficiency exhibited by the regulators, and it is possible. So if it is possible, why it should not be possible in the future? And I think this is something which is important to push forward. So the importance of reliance and innovation in regulatory mechanisms like the revised guidance on EUL document has brought value to the manufacturers, and platform technology and benefit risk concept is a new regulatory way of thinking. I think it was very, very nice to see the regulatory agility where the efficient regulator is defined, the one who is open to learn, exhibits agility and urgency, is collaborative and is stringent, still follows science-based decisions. So collaborations with SRAs and WHO on continuous need of data generation on how to conduct on-site inspections, clinical trials, transportation of materials, equipment, parallel testing, I think during lockdowns was a highlight of the day. Once again, evaluation of AEFI during a deployment, particularly during COVID crisis, came clearly, and I think the vaccine efficacy surveillance, the advantages were clear, like it prevents infection, prevents reoccurrence, prevents hospitalization, and prevents death. So the role of national regulatory authorities has been essential and central for the deployment of vaccines through COVID-19 pandemic, and a lot of changes in procedure were established to respond adequately in an agile manner. Once again, universal health coverage, and in this, I remember Dr. Richard Hatchett's statement, the low and middle income countries must allow life course vaccination for adults as part of the expanded and increased commitment to universal health coverage. And he emphasized the need of South-South collaboration and gave examples of companies like Serum Institute of India and Aspen. So on research and development, if you recall, Dr. Soumya Swaminathan had mentioned that vaccines save lives and are public goods. Governments, multilateral agencies, and industries need to partner so that there is public investment and oversight to ensure that public health needs are met. Human capital, talent mapping, and workforce deployment is one of the most critical areas which has emerged out of discussions even today. People decisions or business decisions is, I think, a very important carry-home message for all of us. And there is a need to support facility expansion to support a broader vaccine sustainable ecosystem. So tech transfer and quality by design were emerging as the two major gaps, and there is a need for increased training, relationship between education and industry, and then both hands-on and theoretical training. So the challenges which we have seen are volatility of outbreaks, demand and timing, unknown around the disease, complex interconnected systems. However, there are opportunities of sustainable business models, both response and routine products, versatile technical capabilities and capacities. Now, the AI 2030 agenda, and I must thank the CEO's forum, which had very crystal clearly brought out the key points that we should be looking at, including pandemic treaty, the global regulatory harmonization, funding, technology, and capability, collaboration, cooperation, and harmonization, and DCVMN platform to be leveraged for this. Again, there was sustainable, successful, and affordable solutions. New technologies, I think including mRNA, and are very exciting, so we need to really work on that. But what is more important was that we need to be also cautious and conscious on environmental friendly technologies. One point which was raised by Dr. Mauricio, that there is no one size fits all solutions, and therefore we need to find solutions for specific problems as well. And again, the biotech industry will be driven by vaccines, I think was very important point which was made. But I take home the message that we need to have common objectives for collaboration and bring manufacturers and, and shrink timelines, not only manufacturers, but regulators and WHO together on one platform. And this is one action point I'm taking for DCVMN for 2023, and we will make sure that we are able to bring them together to help expedite fast-track approvals for various, first of all, the minds have to be together on one platform, and then the actions to follow. And I'm deeply impressed with the idea of scientific council, as also Dr. Ella's suggestion and advice on conducting a case study. So with this, of course, I have jotted down a few points that we need to work as next steps to work closely with international health and finance agencies to develop implementable, realistic plans to increase voice share and wallet share for the DCVMNs, because this 5% needs to change. On Africa initiative, of course, we'll be working very, very closely with BMGF, SEPI, PATH, and Nimble. And for the next AGM, we'll need to create some working groups comprising of all stakeholders well in advance, who will discuss, debate all pros and cons, and present the final conclusions or robust action plans during the AGM, rather than only greet and meet. So now what I would suggest here is that it's a pleasant duty to offer vote of thanks. So I will very humbly, I would like to thank Dr. Mansukh Mandavia, who was kind enough to spare his valuable time, the Honorable Union Minister of Health and Family Welfare and Minister of Chemicals and Fertilizers, Government of India. Leadership of all global agencies, including WHO, Gavi, SEPI, UNICEF, PAHO, BMGF, PATH, CHAI, DFC, IFC, ADVAC, and their participants in person and online. All managements and executives from all member companies, both in person and online. All chairs, speakers, and of course you, ladies and gentlemen, being an excellent, supportive audience. And of course, I don't want to forget our sponsors, who have contributed tremendously without raising a single voice when they were asked to provide support for this meeting. I am also thankful to my friend Shyam McDowell, who was very, very, very nicely, he has entertained you all last evening. My best of thanks to my friend Jehan, who should be sitting somewhere at the back, but all this is happening because of Jehan and Rachna, Namiraj, Shreya, Prachi, and entire crew of his organization. So big hand for them. You had flawless technology and everything went smoothly. This is only because of Salil, Ankush, and their full technical team, and I think they deserve a big clap. He is not here, but I want to thank him in absentia, the General Manager of Ritz-Carlton, Mr. Nishant Vishwanath, and entire team of Ritz-Carlton, and particularly Maina, Ayan, Lubhan, and Shri, who have been going out of the way to make sure that all of you are fully comfortable. Service with smile was absolutely visible. So big hand for them. I also take this opportunity to thank my friends in Secretariat, particularly Sonia Villasnor. Please stand up. Prerna, Ayla, Tamire, Laura, you can stand up virtually if you are attending, and Sivashan, again virtually, and Sonia Paglusi if you are around somewhere here. Thank you very much. I would like to specifically thank the board of DCVMN Chair, Mr. Sai Prasad, please. Vice Chair, Mr. Patrick Tipu. Mr. Tiago. Mr. Adrian Shah. Whom I have forgotten? If I've forgotten somebody, Fernando, who was giving all the money. And Ling Jiang, are you there somewhere on the cloud? So big hand for Ling Jiang. And ladies and gentlemen, I think above all, we need to thank Mr. Adar Poonawalla once again, a very big hand. You won't believe, I had offered to all my manufacturers to co-host this meeting. And then I came to Pune and I just had an opportunity to meet Adar and discuss with him. So he said, where are you conducting the meeting? So I said, I'm planning. He said, why are you planning? Why don't you do it here? So I said, yeah, we can do it here, but where? Which venue? He said, you have Ritz-Carlton, take it. I said, okay. So I took Ritz-Carlton. And then he said, Mr. Suri, I am going to announce, of course he forgot, I think, that the hotel is mine, but if anything goes wrong, Mr. Suri is responsible. So I think for that, let's give a big hand. This is the amount of confidence, delegation, and complete understanding that he has not given a single instruction to anybody in the hotel for organization of this program. Not a single instruction, and I am deeply, deeply indebted for that. And now, my friends, I want to announce that the next destination for AGM 24 is, any guesses? Who said that? Are you going to pay for that? Okay, so it is Cape Town, South Africa. Big hand to Morena, to Patrick, and to Farah. So, you know, this was confidential information, and I think I have not shared to anybody, but if I have shared, then you have not heard before this. So, and now I want to tender apology to anybody whom I have hurt knowingly or unknowingly. So, my apologies. Thank you.